A Make America Healthy Again representative has just destroyed a CNN host on live TV. The U.S. Food and Drug Administration's commissioner, Dr. Marty Makary, joined with CNN's Dana Bash on national television to discuss various topics, including the recent move to get rid of artificial food dyes. Following this, the host tried to criticize RFK and also the FDA for reckless cuts to the department. Dr. Makary responded perfectly by not only standing by RFK and the new changes to their departments, but also explaining exactly why these changes are necessary. Here are the highlights.
Why are these petroleum-based dyes in our food and in our medication in the first place?
Well, good question, Dana. I don't think we appreciated the potential risks to human health and child health when they were first introduced. Yellow dye number 5, for example, was noted to be a bright, vibrant yellow color as the byproduct of coal tar in the coal ash, and then people decided to put it in fabric, and then they thought, well, we can put it in food. The studies have caught up with the introduction of these petroleum-based chemical food dyes, and the data doesn't look good. Studies have shown an association with ADHD. It also makes ultra-processed food look more attractive for young kids, messing with their minds where they feel full and they want more of the food. And we've got an epidemic of childhood chronic diseases, so we are erring on the safe side and moving to remove these from the U.S. food supply.
Dr. Makary, I do want to ask about something that happened at the NIH last week. Dr. Kevin Hall, who is a top researcher on this issue, ultra-processed foods, he quit because he says he experienced censorship under RFK. What is your response to this criticism? And more broadly, how concerned are both of you about losing somebody who is so focused on the issues that you care so much about, which is finding out about these ultra-processed foods?
Well, I don't know that individual. I understood that he resigned. I think there are some people who, when they are resigning, are taking some cheap shots. Look, Republican, Democrat, independent moms turned out to vote for President Trump on this very issue that Secretary Kennedy has championed. So I think we need to recognize getting petroleum-based food dyes is not a silver bullet. It's not going to instantly convert America's kids to being a healthy generation, but it's one step, and there's a lot of unity around this individual topic.
Somebody who was at the FDA, who left before you were confirmed. His name is Jim Jones. He oversaw food and nutrition policy at the FDA, and he said he was resigning because his work was compromised by thoughtless cuts at the FDA. Both he and Dr. Hall, what they're saying, again, is that they're excited about the MAHA movement. They're excited about food safety goals. But is your ability to make meaningful progress stunted because the personnel are no longer in place to accomplish your goals with all of these cuts?
No, Dana, and I'm glad you asked, because all the cuts were limited to communications staff. You would not believe the number of communications staff at the agency. Redundancies in IT and in legislative affairs and lobbyists from the FDA to the Hill. There's been a fiefdom culture, and we're now eliminating redundancies and consolidating those services. No cuts were made. There were no layoffs to scientists or food inspectors. And my job as commissioner, coming in after those cuts, is to make sure that the scientists and inspectors have all the resources they need to do their job well. And you're going to see some cheap shots from an individual that takes a early retirement offering, and they might say, well, look, we're concerned, we're leaving because of safety concerns. But I can tell you there were no cuts to scientists or inspectors, and my job is to make sure that we're doing our job well in a more efficient way. Any discussion of cuts, Dana, has to mention that the FDA has doubled its number of employees since 2006. The headcount has increased by 100%. And so that's the important context when we understand how to make the organization more efficient.
So, for example, according to the CDC, foodborne illnesses are on the rise in the U.S. You're going to continue to inform people when there are outbreaks of foodborne illnesses?
Yeah, I think we're going to be more efficient, because when you have over 100 communications staff, you lose that sense of owning the delegation of responsibilities. And that's our challenge. These transitions are never easy, and the cuts are never perfect, but I think we're going to be stronger for it. And I do believe in the scientists and inspectors at the FDA.
Going forward, it will be interesting to see if the tone of the mainstream media changes as these departments show the competency of their decision-making and as the public sentiment changes, likely in their favor. Let us know your thoughts on this interview in the comments section below. And make sure to like and subscribe for more content from us.